like to introduce Marina Bowshall. Marina is the Chief Executive of Preventive Health SA, who's an experienced policy and health services professional and who has a reputation for delivering and influencing public health outcomes through effective integrated responses to provide the official opening of today. Thanks very much, Marina.
Thank you very much, Jackie. Now I'm just checking I'm going to press the right buttons here so I don't get in too much trouble. There we go. I'd also like to acknowledge the land we meet on today as the lands of the Kaurna people, and also really acknowledge Cliffy. I've been privileged to be at quite a few of his welcomes to country, and it's always such a great pleasure to be educated generously by the Kaurna people on lands that we're meeting today. And reaffirm the commitment of Preventive Health SA and myself to walk alongside in reconciliation with Kaurna people and the Aboriginal people of South Australia, recognising that allyship and working collaboratively and learning from the oldest continuing living culture in the world is important and also a real privileged aspect of working here in South Australia. Before I get into a little bit of why I'm here, I suppose, I start by saying I might be the most boring part of today's scenario. There's so many wonderful presentations and great research that's occurring across the state, so I won't hold you up too long. But hearing NCEDA's 34 years old, that is rather ageing, because I think I started working alongside in partnership with NCEDA in 1998. So I missed the first 4 years, but have been along on the journey since then. And it's a real privilege to be here today to open today's symposium, and I thank you for the invitation. But also I want to acknowledge the amazing work that NCEDA has done throughout that period, not just within South Australia, but at the national and at times international level. And I think that is particularly important when we look at the data Jackie has just presented and the challenges before us, but also the enormous talent we have here in this state as researchers, clinicians, policymakers, advocates, which is supported by incredible data and research that NCEDA is able to offer us. And I particularly want to acknowledge Jackie because NCEDA's been around obviously for 34 years, but I think the last several years under her leadership have been outstanding. And I think she's really put NCEDA even more so on the map and has certainly created an opportunity for partnerships with groups like Preventive Health SA to see how the research, the data and the policy can actually be transformational in policy and programs in the South Australian community. And that's your leadership, Jackie, so thank you very much. So to get on to the kind of boring policy bits, but nevertheless important policy bits that this work is here to influence. Preventive Health SA is the state's prevention agency for those online who might not be aware or those in the room. And we have a range of different areas of focus, but alcohol and other drugs and tobacco or vaping are two that are particularly relevant for the people in the room today. With that in mind, we lead whole of government across state action in those two areas, and importantly, two key components. The South Australian Tobacco Control Strategy, which is the strategy that all of government has signed on to, and in fact, a lot of the community services organisations are also represented in that strategy, and I thank Cancer Council for being one of the key agencies working with us in this area. And that focus is to reduce daily smoking rates to 6% by 2027. And we know that's ambitious, but in addition, because we like to have a little bit more fire in our belly, we also want to make sure we're the state that has the lowest tobacco smoking rates in the country and that we're leading nationally. And that's been signed off as the ambition of the state government, or the ambition of our partners, and the ambition not just of Preventive Health, but a range of agencies and government and non-government across the state. We also have a state alcohol and other drug strategy, and that strategy was released a couple of years after the tobacco strategy, again, whole of government. And it's really important that we think about the challenges we faced within that context. We know there are determinants of health. We know there are economic levers. We know there are disproportionate health outcomes for different population groups within our community. So having other agencies, whether that be corrections or human services, treasury and finance, premier and cabinet, education, not-for-profits involved in delivering and learning and repositioning work in these areas to get better health outcomes for the community is vitally important. But that also creates the challenge. So how do we ensure that these efforts are focused, where they will have the greatest impact? And fortunately, we've got some great data that can tell us that. And unfortunately, we've got some areas which are still a little developmental, a little underdone. We need to think more deeply about them. And that's where groups like NCEDA are so important to help guide that deep thinking and to translate the data we have into practical, pragmatic opportunities for policy and programmatic action across the state. We also need to bring other people along with us. I know ambitions can be high, but we might have great scientific evidence. It would be lovely if we had a lot of resources, but we have some, but it's always nice to have more. I'm sure everyone in the room is not into that. But we also need to bring the public with us, because at the end of the day, policy is set in the context of our democracy. It's set in the context of what South Australian public or the Australian public are seeking as the type of community in which they want to live. And so it's important that we don't just think about why isn't the science being applied, but how are we bringing the community along so they are understanding the science, so they're able to lean in and support and foster the developments we need to get better health outcomes in the community. So in regard to our approach, we've obviously got these two strategic areas of governance, but we're working across a range of different agencies. I had the privilege of leading DASA for a few years, and it's great to see DASA people here today. It's lovely to connect with old friends and to see some new friends in the room as well. But we're wanting to make sure that when we do this work, we're connecting across a whole range of different sectors, whether that be the Attorney General's Department and the justice portfolios, whether it be policing, whether it be clinical service provision and clinical expertise and knowledge through groups like DASA, whether it be through policy setting enterprises and commissioning enterprises like the Department of Health and Wellbeing, or whether there's a whole range of other government agencies. And fortunately, in this state, we have these strategies and the mechanisms through our governance of these strategies to actually move with all of these agencies to try and deliver considered, collaborative and evidence-based approaches. But how do we know it will work? How do we know we're putting the effort where we need to? That's where our partnership with NCEDA has grown in the last year or so by funding the Substance Use Research and Evaluation Program. And we're really, really grateful to be working with NCEDA in this area. We've made a commitment in Preventive Health SA to be evidence-based, bold, and to really hunt down getting better health outcomes for the state. But we need to do that in a really transparent and accountable way. And I'm interested not only in getting the job done, but improving as we go along, making sure we're reflecting the evidence, but being transparent with the people in this room and online about how we're progressing and where we're not progressing so we can do better. We can translate evidence into practice more effectively. We can develop new research protocols to find out what we need to do differently. And we're grateful that NCEDA have come on board to be the leader in that work for us. So it's not government assessing government or government determining what's the next step or where we've perhaps had some benefit or some negative consequences of some actions. But we've got an independent, robust, peer-reviewed centre of excellence that is able to guide the way. And I'm sure you'll be hearing a lot about the research from the SURE program today and the many other programs that NCEDA offers, which enable government to really get clarity on those decisions. We're interested in making sure the data that we're receiving can be translated into really clear insights. We want to then take action with it, and I recognise that can sometimes feel long and not as timely as we would like, but we're a product of the environment in which we're working. What I will say is where the evidence is solid and where the ambition and outcomes we want to measure are clear, we get investment. And it was really pleasing to see yesterday the Minister for Health launch NCEDA's first report through SURE to say that smoking rates in South Australia are now down to 7.5%, the lowest ever on record. And that's because of the partnership between all of these agencies in the room and across Australia to work collaboratively on public health evidence to get the job done. So what are the next steps? Well, as I said, it's a fairly new partnership with NCEDA, the SURE program, but we're really excited around where it can take us. We're going to have a focus on policy and regulation. We know that the big policy levers are the levers that are going to make the most significant change across the whole of population and shift the bell curve towards better health. We're going to be looking at public education and campaigns because, like I said, we need to bring the community with us. It's not enough to have the science. It's not enough even perhaps to have the resilience and rigour. We need to also make sure it's something that we can educate the public on around the need and the benefit. We are also interested in targeted action, which we'll be working on through very focused work around place-based and community-led responses, because policy alone will shift the curve, but it won't necessarily shift the equity lens. And so we need to have a very focused equity approach, which has a targeted action. And then, of course, we want to have the data and the innovation. We don't want to just be sitting here and resting on our laurels. We want to say, what next? How do we continue to drive down the issues that we need to be looking at? So that's us in a short summary. I recognise that this is most probably a bit dry for the researchers in the room who are saying that give me statistical data sets. But what I want to say is that this is the shared mission and vision of the state, and your contribution is immensely valuable. Your rigour, your intellect, your resilience is immensely valuable. And we're really looking forward to hearing about the great outcomes of your research today and continuing to partner with NCETA so we can deliver more great outcomes for the health of South Australians into the future. So thank you.